In this video, we're going to look at athletic groin pain. It's a very frustrating condition for people. People often have several failed attempts at going from being in pain to returning to play. There's lots of reasons for that. In this video, we're going to go through the diagnosis, the pain pattern, and give you the exact exercises that you can do yourself to take you from being unable to play and train into phase 2 of the program. My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Lucan in Dublin. One of the issues with this condition is that it's called lots of different things. So osteitis pubis, Gilmore's groin, athletic groin pain, athletic pelvic overload. There's lots of different terms, but it doesn't help people in their attempts to go from being in pain to getting returned to play. The consensus now is to call it athletic groin pain, but it can happen in a number of different areas in and around your pelvic and groin areas. So you've got your adductor related groin pain here, you've got your iliopsoas or hip flexor pain here, you've got your inguinal issue here, and abdominal issue here. Oftentimes these conditions coexist, and we rarely see someone with just one particular issue. There's also a huge overlap in the exercises you need to do to get yourself back into return to play. So sometimes the diagnosis is kind of important, and sometimes it's not that important. In terms of the pattern here, it can start in an acute way or in a gradual way, but regardless of how it starts, it can become a very long-standing problem. And apart from getting a clear diagnosis as an issue, the pattern of pain can be one of the reasons why this happens. What usually happens is people feel pain, maybe in activity or towards the end of their activity, but definitely the next day, and people report morning pain. Then though, the pain starts to reduce as you get up and about your daily activities, and it definitely improves with the warm-up. So you're actually able to train 2 or 3 days later. And that pattern can keep going, where you feel quite sore and achy after training, but when 2 or 3 days pass, you're able to get back into it again. Your symptoms will reduce once you rest a little bit, but they return as you resume your activity. The next stage is that it takes longer for your pain to go away, or your pain doesn't really go away in your activity, and you suffer far worse afterwards. The pain doesn't go by lunchtime the next day. It's hanging around for 2, 3, 4 days, or you're suffering for a week. The progression of this is one of general deterioration, where you lose your pace, you're unable to recover, you're unable to do the training that you need to do, you're definitely not able to perform, you feel that pain all the time, and it ends up with people having to stop their activity to try and get it sorted. The issue is rest in no way helps get this sorted. Just going back to the diagnosis of it again. So you can have adductor related groin pain. So if you've got pain going side to side, or twisting and turning, or kicking a ball, it might be more adductor related. If you get pain running in a straight line or jogging, it might be hip flexor related. If you have pain maybe coughing or sitting up out of bed, it can be the inguinal area or the abdominal area. Regardless, there's a massive overlap in the exercises you need to do to recover from this condition and get back playing. So let's go through the 6 exercises in phase 1. So the first exercise is a bent leg adductor squeeze. So you're going to use something to put in between your knees, either a foam roller, a rolled up bath towel, a pillow, a soft ball, doesn't really matter, but there are a few little things we need to talk about in terms of this squeeze. So legs are nice and bent here. Now, when you're doing this exercise, you never want to have pain more than really a 1 or 2 out of 10. That is acceptable, but we're not going above that. The other really important factor to think about here though is you're never going to squeeze this more than 50% of your effort. There's so much of this work in this whole program that if we over squeeze on this, you're actually going to make yourself sorer. So the maximum you'd ever squeeze is 50%, but if 30 or 40% gives you that 1 or 2 out of 10 pain, you bring it down to that amount. If you can only squeeze 20%, you bring it down to 20%. As your body adapts, you'll be able to get it more, but the maximum will always just be a 50% squeeze on this at all times. So what we're going to do is just, when you're doing it, everything is nice and relaxed. You're trying not to be tense during it, and the purpose of this is that you feel the adductor muscles here working. So low level squeeze, less than 50%. We're going to go for 10 seconds on, and then taking a 10-second break. That would be 1 rep, and you're going to do 10 repetitions of that. On to the second exercise, which we're going to pair with it. We're going to work the hips and glutes. So that first exercise worked the adductors and groins a lot. Now we're going to go with the hips and glutes. It's a good one to pair with it because you're working the opposite side of the joint. Now here, you're going to lift your hips up just so your fists can get in underneath your tailbone, and you're pushing your knees out as far as you can and all the way back in. So depending on the strength of the band, you might do it in say 10s. The purpose of this though is that you feel the muscle activity out here. If you have quite a weak band, you're going to have to do quite a few of them. Let's say we do them in 10s or 15s. Stop, take a break, give yourself 10 seconds and do as many as you need to get a really good burn here. If you're using a very strong band, you might only have to do 5, 6, 7 reps. Try and get a band that's strong enough so you don't have to do more than 10. But they're the first 2 exercises. The adductor squeeze followed by the band exercise here to work the hips and glutes. I would pair those together and I would do your 3 or 4 rounds of that before moving on to the next 2 exercises. So, exercise number 3, similar to the first exercise, except it's going to be a long lever hold here, where you put whatever it is in between your feet. You won't get as much of a squeeze here. It's a little bit more difficult than the bent leg version, but again, you're squeezing here, everywhere is relaxed. The purpose of this is to get the groin muscles working. Remember, never more than a 50% squeeze or never more than a 1 or 2 out of 10 pain in the affected area, but it's absolutely fine to feel a little bit of work there. What you want is, we're going to get these muscles working. Let's go for a 10-second on, 10-second off system again, and we're going to go for 10 repetitions in a set. So that's the third exercise, and we're going to pair that with the next exercise here, which again, we're going to work the hips and glutes. So to give the groins a rest again, we're going to go with the frog pumps, where you push your knees out as far as you can and you're bridging up and down. And as you're going here, again, the purpose of this is that you start to feel your hips and glutes working hard here. Keep the outward intent into the band. Let's say you do 10 reps, take a break, 8 to 10 rounds of that would be your set. That's the fourth exercise. So again, you pair exercise 3 and 4, do your 3 or 4 rounds of that before moving on to the last 2 exercises. The fifth exercise here is a little bit more technical. So we're going to have, again, a light squeeze of the foam roller in between the knees. And what you're going to do is apply downward pressure through your arms. So not letting me lift your arms up like that. You have downward intent there. That's going to mean that we engage our abdominal muscles a little bit more. Again, a light squeeze here. And what you're doing is bringing it all the way up. And at the same time, you're going to curl your head and your shoulders up off the pillow so that you feel your abdominal area and your groin muscles working. The entire effort should take a good 10 seconds. Again, you're taking 10 seconds of a rest. That would be 1 repetition, and we're doing 10 repetitions in a set. Let's do another one. So downward intent here, squeeze, and let's go. Curling the head and shoulders up just a couple of inches, getting this up as high as you possibly can go. This is the toughest exercise so far. And slowly controlling it all the way back down. This, like all the other exercises, should feel tiring but not sore. If you get to rep 7, 8, 9 and you start to get some pain, all that means is, look, you're at your capacity to stop at that. But if you're able to get 10 repetitions of that done, and the 6th exercise then that we're going to pair with this is your single leg bridge. So bringing the other leg up, downward intent through here and bridging up. Let's hold it for 3 to 5 seconds. And again, we're going to repeat that on each leg. And let's do 10 or so repetitions in a set. That's your 6th exercise. So there's our 6 exercises involved in phase 1. They're all on your back. It's pretty tedious, to be honest with you. You need to be doing 3 or 4 rounds of this, and it's going to take you between 30 or 40 minutes to get this done. You probably need to do 2 days on, 1 day off. So in a 7-day span, you're getting 5 days of work done. It is a lot of work, but this is really, really important. You won't be able to move on to phase 2 and phase 3 exercises if we don't have this foundation built. So it's 6 exercises. Takes you 30 or 40 minutes, 3 or 4 sets of it, 2 days on, 1 day off. You should feel the area tired and working, but not sore. If you have any questions on this, feel free to reach out or comment below, and we'll be glad to help. And stay tuned for our phase 2 exercises, which are the ones that you will do after these.